What I'm going to discuss is when is laser treatment not enough for port wine stains? And one of the situations that as a surgeon I see very, very commonly is overgrowth patterns. And we're about to publish a paper where we've tried to classify these overgrowth patterns. And what we find is very interesting. We find that there is tissue hypertrophy, which we all see. And tissue hypertrophy usually starts at around 8, 9, 10 years of age. The upper and lower lips are very commonly involved. But one of the things that's very important is that we do see bony overgrowth. And this is very, very important. It's a dermatomal problem. It involves the entire dermatome. And in fact, as a surgeon, if you cut through the tissue, you'll see that it involves skin, subcutaneous tissue, muscle, and bone, the entire dermatome. We've looked at our experience with cobblestones, and a very high percentage of patients develop cobblestones, especially port wine stains of the head and neck. In our series, it was 44%, and the average age of onset was around 22 years. They start off as a compressible nodule, and over time, they become fibrotic and not compressible. And this is important because a compressible nodule can be treated with laser. A nodule that is mature and fibrosed can no longer be treated with laser and would need to be excised or use some other mechanism. So that's important. Now, the last category is something that I'm about to publish, and I've called it hematomatous growth formation. And I'll show you some examples. It's probably or possibly a continuation of tissue hypertrophy, but we're doing some genetic studies, and it seems that this is not so, that this is a unique group of conditions. So let's start off with tissue hypertrophy. We've all seen patients like these two, and you can see this lady with cheek, upper lip involvement, and this young man with both upper and lower lip hypertrophy. Another example, and if you see with her open mouth there, you can see that her maxilla is overgrown, and so her bite is canted, and you can see the sloping of her bite. This entire maxilla is overgrown with hypertrophy. Another example, and you can see the lengthening of the lip. And what I found is that the lip is lengthened in both the vertical and horizontal plane. So if you measure the distance from midline to the edge or the commissure on one side and on the other, you'll see that it's different. Now, here are some examples, extreme examples of cobblestone formation, and you can see some of the earlier, let me go back. You can see some of the earlier cobblestones over here and some more advanced cobblestone formation. And you know, as a surgeon, by the time I get these patients, everybody's tried everything else. So I promised you I'd show you hematomatous mass formation, and here is an example. Now, is this extreme cobblestone formation, or is this something unique, something different? I've seen a few of these patients. I've looked at them histologically, and this is not extreme cobblestone formation. This is unique. These patients present with these hematomatous masses that just grow and grow and grow and grow. Here's another example of a young girl who presented, and by the time she was in her mid-20s, that's what she looked like. So I've called this hematomatous mass formation, and here is her progression. And you can see her progress from a simple port wine stain all the way towards this. Now, obviously, we all know that this is not a common occurrence. So, with capillary malformations, we know that the standard of care is pulse dye laser. Obviously, lots of other lasers have been tried, but pulse dye lasers have stood the test of time. For tissue overgrowth, I have found that surgical treatment is very important, and I'll show you some examples. Now, we can add chemotherapy, but to date we've not had the necessity, or we've not found it necessary. But it's important to remember that if you have a hammer, everything looks like a nail. I'm at the ASLMS, and so obviously we're going to be using lasers for everything that we treat, but it's important to consider other modalities. We have lots of drugs that are being developed. MEK inhibitors are very, very interesting for vascular lesions, and of course surgery should be considered. And it's important to realize that this is a multidisciplinary approach, and that we should always approach these problems in this way. Remember the olden days. This patient was treated with an argon laser and a skin graft. This is not a patient of mine, but I put this slide up to remind some of the older people like Moshe and myself, who've been around for a long time, who remember seeing patients like this, and we don't really see them lately or these days, but those were the olden days. So how do we treat these conditions? So let's start with cobblestones. If the cobblestone is early, it's vascular, it's compressible, you can treat it with a laser. I've used pulse dye laser. You zap it 2 or 3 times. You can use a neodymium YAG laser with dynamic cooling. You can use any laser that will give you an adequate result. But if the cobblestone is mature and firm and not compressible, then we need to try something else. And in my experience, it's been surgery. So here's an example. That one and that one are not compressible. These other tiny cobblestones are just starting, and they can be treated with laser. So here are some examples. You can see the 2 very large cobblestones. When this patient came to me, she said, I'm not interested in, you just leave the rest of my birthmark. I've lived with it all my life. Just these 2 big cobblestones are really, I find very disturbing. Can you remove them? And of course, I can remove them. But at this stage, I try to encourage her to have the rest of her birthmark treated, but she was not interested. But nonetheless, you can see the results of surgery. Here's this other patient who had these massive cobblestones, and he still has some cobblestones left, but he looks a lot more respectable after surgical resection. I would love to put him on a MEK inhibitor. I'd love to start laser treatment, but he was satisfied with this. Another example, and you can see the tremendous hypertrophy, and here he is after resection, before and after surgery. And this is one of the problems that we face in surgery. You see this hypertrophy of the lower lip, which we frequently see. It's a difficult surgical problem, and it took me many years before I figured out how to actually approach this. And you need to approach it from internally and externally, and he has an incision along his familiocutaneous junction, which I think you can see. And without that, it's impossible to get rid of this. So here's another example of somebody who'd already had skin grafts, came to me, and there she is after laser treatment. Another example, and that initial patient that I showed you, and there she is after 1 round of surgery and some laser treatment. And you know, you can continue and get a pretty good result. But I was very thankful to her because I was able to get some tissue for examination. And clearly you can see she's got still some thickening below her chin, which can be resected, and we can do aggressive laser treatment over there. But what I wanted to do was show the surgical approach. And this is something I rarely do. In this particular patient, I put a skin graft in there, and she still has some eye involvement. We're trying to figure out what to do. She's blind in that eye, so we're probably going to put a prosthesis in. And with my oculoplastic friend, Erin Fay, we'll probably raise her eyelid. So, what are the questions to answer? Well, what are the pathologic signatures of these? Well, we're looking at the genetics, and at some point in the near future, we will be publishing the genetic analysis. There are signature genes for these conditions. So, very important. Are there any specific genetic mutations? Well, I said yes. And how does this correlate with treatment? Well, multidisciplinary approach is important. Drug therapy is important. Laser therapy and surgery should be considered. And the experience of the surgeon, I think, is very important. And how can these be prevented? Well, I remember the olden days going to a laser meeting, and a very prominent laser person got up and said, if you treat them aggressively at an early stage, you can prevent overgrowth. This is not true. I've treated these very aggressively, and you cannot prevent that which is genetically predetermined. So, thank you very much.
Thank you, Milton.